My name is Maureen Ochieng, and I work for Investing in Children and Their Society. I am the programs coordinator, and I'm based in the Western Kenya region. So these are interventions that seek to end violence against children in and around schools. We support caregivers by giving them skills to parent, and so we train them on skillful parenting, and also we work with teachers to build their capacity to support the children better, and we also train the pupils on life skills interventions. When we did the mapping together with the prevention collaborative team, we realized that the places where VAU occurs are the same places where VAC, violence against children, occurs. So if they occur at home or in school or within the community, those are the same places where violence against children, for example, occurs. So for example, issues of drug abuse, issues of poverty, they lead to violence against children, but these same issues, these same causes lead to abuse for women.
For example, one of the activities that was introduced was something called the human box.
Men and women box.
The gender box.
I was still in my box till I attend to this training, and I was like, how? Wow, I have to definitely get out of my box.
One of the things that the team did is they took that away, they tested it out, and then they came back and they said, well, actually, I think, we need a really practical example of how this works. So they added that kind of experiential layer. Then we thought about how that would get reintegrated into the curriculum.
For us, this has been a journey of 18 months. While the team realized that this was important, there were also other competing priorities within the organization. So the bigger challenge was to get everybody on board and to also have personal convictions from individual staff as to why this was important. Remember, we are also operating in an environment where gender dynamics and biases are common. So we also had to have a personal transformation, and that took time for the team to change themselves, be convicted, and then now we look at our programming. And that required a lot of capacity development efforts and time against competing priorities.
The occurrence of the violence against women and violence against children, I was not aware that these things can be happening in the same place. Now it's my song. Anywhere I go, everyone I meet with, I say, no, you can't separate the two things. We need to integrate this.
The other aspect that we were looking at in terms of implementation, of course, other than delivering this through the parenting trainings, we would have to have a way of facilitating these reflections better with families, with parents and caregivers, methods that are culturally acceptable in our context. So we were exposed to a number of opportunities and models in Africa and also in other continents, and we had to pick and test and come back and say this doesn't work in our African context or Kenyan context, but this works. So it was a give and take, test, try and see whether it works. So the methodology of reflections around gender really mattered a lot, and that took a lot of time. But we are in that place where we are now comfortable that the methods we have settled on will sit well in our cultural contexts.